just with TLC, tender loving care.
And you actually feel the baby's movements is anywhere between 16 to 24 weeks.
So sex in pregnancy is not going to harm the baby.
I'm Dr. Rohan Palshetkar, a practicing obstetrician and gynecologist from Mumbai. Dr. Pradnya Supe, who's also a practicing obstetrician and gynecologist in Mumbai with a special interest in breastfeeding and lactation consultant. Dr. Bela Shah, she's an IVF and endoscopic surgeon from Indore. So I'm going to get down straight to brass tacks and I'm going to begin with the first question. What are the changes that are going to happen to my body now that I'm pregnant? How do you counsel your patients when they come in the first trimester and you're trying to explain to them about the changes that their body is going to go through?
Yeah, very rightly said. Usually patients don't come in the pre-pregnancy period where actually this counseling is supposed to happen. But again, whenever in the first trimester they come with this positive UPT and they're so anxious. So we need to counsel them that during pregnancy, every trimester is going to have different changes. And they need to be primed with these in advance so that, they can deal with them much better. So whenever patients come to me, first of all, the commonest complaint that these patients have is nausea and vomiting, of course. So they need to be counseled that this is the most common complaint, especially in the first trimester. Appropriate medications and support from the family, they can definitely tackle. Apart from that, patients have breast tenderness, sometimes there is breast fullness, patients have certain food cravings or sometimes even aversions. So these changes, they need to be counseled about in advance. They also have mood swings and not just in the first trimester but throughout pregnancy because of all the hormonal changes. So I think the patient as well as the attendant, the husband or the relatives need to be counseled about the mood swings that the patient is going to undergo throughout her pregnancy. And as the pregnancy advances, there are a lot of other changes that can also happen. Like, there will be weight gain, there will be frequent urination, stretch marks.
That's what comes around. And I think those are things, I think the first 3 months is the most crucial where they are most afraid of these changes happening. And Bela, I think you brought up some very good points because morning sickness is something that plagues almost a majority of women. There are very few women who actually manage to escape it. And I think you said it beautifully that just with TLC, tender loving care, and a few of the medicines, they can be managed beautifully. We're coming to the second trimester. The patients come to you and they're like, ma'am, I can't feel the baby moving at all. It's been like 4 months and I can't feel it. Like there are so many myths that we hear about pregnancy. People ask us whether we should shower or whatnot. What are the 2 or 3 most common myths that you've heard?
So I think one of the commonest myths that I've come across lately is that we as gynecologists, obstetricians advise so many sonographies. So there's a myth that too many sonographies can also harm your baby. Or doing a sonography internally, which we commonly call as transvaginal sonography, that again can harm the baby in the first trimester. That is again a myth, and patients have to be counseled that this is definitely not true. Another myth which I think you commonly encounter is by looking at the woman. Is she carrying too high? Is she carrying too low? She's carrying too high, it's a baby boy. If she's carrying too low, it's a baby girl. So that is another myth which we commonly hear from patients.
Absolutely, Pradnya. I think that when these questions come to us, sometimes I feel we are also stumped with them because how do you explain them with scientific backing that these are absolute myths?
Yes, definitely.
Bela, now another thing for all our viewers out there, what I want you to talk about is sex during pregnancy. That's also another thing that a lot of couples ask, that is it safe to have sex during pregnancy? Because if I'm having sex, is it going to really hurt my baby? What's the viewpoint and what should we be actually putting the message out there? Is it safe or not?
First of all, the message that I want to give all the viewers is that if you have this doubt, don't ask around, ask your friends, ask your neighbors, but the healthcare provider or your doctor is the person you need to ask this question to. Do not feel shy. You can, open up. And so sex in pregnancy it's not going to harm the baby, first of all, because the baby is inside the uterus and the during sex, the penis enters into the vagina. So these patients have this misconception that it's going to directly hurt the baby, but the baby is nicely protected with lot of muscle and there's fluid around the baby, so it's not going to harm the baby. But again, you need to consult with your doctor, because if your pregnancy is high risk, that means if there is placenta previa, that is low lying placenta, or if you have any history of bleeding or leaking, or if there is history of cervical incompetence, that is the cervix opens up prematurely, so in those cases we would advise to avoid sex, but otherwise as such it does not hurt the baby.
When do you actually start feeling the baby's movements and you're able to experience that joy?
So see, the ideal time when you actually feel the baby's movements is anywhere between 16 to 24 weeks. Normally, if it's a patient's first pregnancy, she tends to feel the baby movements a little later on, approximately 23, 24 weeks. For patients who are pregnant the second time or the third time, they will feel baby movements maybe as early as 16 weeks, 17 weeks as well. So it's important to reassure her that she will feel baby movements maybe at the end of 5 months, at the end of 6 months, and it's absolutely normal to feel it even that late, especially in the first pregnancy.
Now, this is another question, Bela, which always troubles me when they ask is the baby fully grown? Is it fully sized and things like that? So what I want to know is, how do we explain to the women that, okay, your baby is fully grown and these are few of the signs that is going to tell you that, look, the baby is growing well and it's absolutely fine.
Correct. So first of all, what we need to tell them is this baby's growth and development is a continuous process. It will continue even after the birth of the baby. And there is no specific definition or a specific point that will tell us that, okay, now the baby's growth is complete. So it's not a very specific point. What we need to tell them is there are certain signs, like for example, if the baby is, their antenatal scans are all good, the baby is putting on weight, or the Doppler parameters are normal, she's feeling fetal movements, even that is a sign that the baby is growing well, even neurologically. And apart from that, the weight gain is appropriate throughout pregnancy, and it is corresponding, the fetal, even the fetal weight is corresponding to the gestational age. I think these are signs that can tell us that the baby is doing well.